abnormal cell growth. So the younger I am when I have my first child, the more progesterone exposure I have over my lifetime, the better off I am. Now that does not count artificial progestins, which are in the birth control or the Prempro or other artificial hormone replacement. Using natural progesterone, especially transdermally on your skin, is having mounting evidence, especially Fournier studies in Europe, that it reduces your risk of cancer for the same reason that Mother Nature reduced our risk of breast cancer when we carry our babies early in our life. So when we do the statistical analysis, we're looking for a number that's 1.67. Statistically, that's the cutoff point at which you consider to be high risk for breast cancer. So oncologists will use that number calculating to help put a woman on drugs, tamoxifen or Avista, raloxifene, which are selective estrogen modulating drugs. They bind to the estrogen receptor, but they don't turn on the machinery the way that estrogen does. So by blocking natural estrogen, we have less risk of developing breast cancer down the road. That's the only tools they have in their toolbox, those two drugs, to prevent cancer. We have so many tools we'll talk about here in a second that we have to offer if you do have a high score on your Gale model. So 1.67 is the number. I went online to cancer.gov, looked at their breast cancer risk tool, or you can just Google Gale model or Google breast cancer calculation, and you'll figure out what it is. I plugged my numbers in. So it turns out that my risk here at age 50 is 1.3. 1.67 is high. I'm in the low category. I'm good with that. Furthermore, it extrapolates my lifetime risk. The risk for me over my lifetime is about 12%. That's about 1 in 8. That's fairly average, although an average woman up to age 90 is about 11.2. There's a little bit lower chance than the rest of the population. I'm a fraction higher risk. Why is that? I didn't have my first baby till I was 35. So that's what shifted my category into a slightly higher amount. But you can do this for you too. So we can add to our risk assessment breast thermography. We learned about that at our last lecture. So in our company that we use, IMS, we use the Marseille system. Marseille is a city in France, and this is an international scoring system. We use the thermography numbers 1 through 5. 1 and 2 are normal, 3, 4, and 5 are abnormal. Sometimes we see this in the research articles with Arabic numbers and sometimes with Roman numerals. It's the same scale. And if you've had a lumpectomy or a mastectomy, they may put that number L or M at the back of your score. So that's what we kind of look for. Currently, there are over 800 peer-reviewed clinical studies on infrared mammogram with a database of over 300,000 women. So the doctor who threw the report across the desk and said, "There's no studies on this, you just wasted your money," is merely unenlightened. There's 800 studies he could read if he wanted to, and they're very favorable. This technology was approved by the FDA in the 1980s and then reapproved in 2004. So this is an FDA-approved technology that doctors are just not aware of. And we believe that the reason why it's predominantly underutilized is because the average family physician, myself included, for the first 18 years of my practice, we were not enlightened enough to know the tools, what to do with the information when we had it. So we didn't do it because we didn't know what to do with the information. Well, now I'm empowered and my staff is empowered to make a change. It's not a perfect test. It's not the be-all and end-all of breast imaging, although it's certainly a beautiful adjunct. It has about a 97% sensitivity. That means that if you have disease, we're going to find it 97% of the time, but we will miss it 3%. On the other hand, sometimes the test will say you don't have any disease, and you did, and that's about a 25% chance, in the same ballpark as mammography. If we combine clinical breast exam and mammography, we increase our sensitivity to about 85%. But if we combine thermography and mammography, we can up that to 98%. So we really have done some great things. I think combining all three is the most prudent thing to do. Let's calculate your Gale model score. Let's do a mammogram at some point. Perhaps not as many as the American Cancer Society wants us to do, but a mammography once in a while is probably not a bad idea. And then add breast thermal imaging, either in between the mammographies or to add data to an abnormal scan to weigh in on whether or not we think we need to biopsy this. If you have a mammogram that shows a lesion, but there's no heat in the lesion, it has no abnormal blood supply, you probably don't need to biopsy it. And we can talk about all kinds of ways to make that scan get better over time.
You know, I did see a study in a British, I think, is it Lancet or something, about the possibility of mammography causing what you were talking about. You said if you knew a study that, I just remember that I did.
Well, good. We'll have to look it up and see if we can find it and add it to our presentation.
Scared about when you say to do
a mammogram and crush. Yeah. So if your scan is good, how do you keep it that way? If your scan is suspicious, what can you do? Well, we're going to spend the next few minutes learning how to care for those girls. Because yes, 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 there's a lot of stuff we can do to make changes. First thing we're going to talk about is changing bra wear and getting some massage therapy. Especially if we focus that massage on the pectoral muscles and lymphatic drainage. The breast tissue is mostly made up of glands that make milk, fat, and lymphatic tissue. And so we need to support that lymphatic drainage. Mother Nature designed our breasts to hang and flow with our movement. In our American culture, we feel it necessary to anchor them against our chest wall and lift them high and tight to show off our cleavage, and yet that's not very physiologic. And we trap all that lymphatic fluid in our breast tissue when it's supposed to be clearing away toxins. Well, we've trapped it against our chest wall and not allowed it to drain out. To my knowledge, to date, there are no rigorous scientific studies supporting massage and bra wear changes, and some call this urban legend. However, my colleagues who have been doing the thermography for 20 years and longer with decades of experience tell us that this tool is absolutely harmless and very probably valuable to breast health. So when we look at some of our bra wear changes that we see, I cannot imagine that this woman has healthy breast tissue. She's got this bra that's holding everything tight. It's totally obstructing lymphatic flow all the way against the lateral sides of the breast. I don't know what her implants are made of, but whatever it is, it's probably not healthy. This woman in her full-size breast has this underwire that's cutting into the chest wall of the sternum, inhibiting all the lymphatic flow inferiorly and cutting off the lymphatic lymph nodes right there in the armpit so that they can't drain well either. So, if you're wearing an outfit where it's fashionably possible to take your bra off, please do so. Wear a camisole instead. Wear a Hanes barely there camisole bra, shelf bra. I'm not wearing a bra today. I have a little camisole on instead. Nobody knew right until I said anything. And 2 years ago, you wouldn't have caught me dead in public without a bra. But now that I know what I know, I want to give an opportunity to move that lymphatic flow as naturally as Mother Nature provided it for me, especially where nobody cares.
Is there a bra built in? A bra built in?
In this, no. No, ma'am.
Really?
Yeah, but if you,
I would be down to my knees.
And sometimes it doesn't matter. So our friend Carol Chapman is a nurse, and Carol developed this technique of personal lymphatic flow enhancement called fluffing. And that's an acronym that stands for Personal Hand Lymphatic Undulation Flow Facilitation. And what that means is we're going to teach you a way to move your own lymphatic fluid and soften your breast tissue. You go online and Google Carol Chapman and breast fluffing, and you can read her handout asking whether or not you have fluffed your girls today.
Carol who?
Chapman. And so this is how you do it. You bend forward at the waist, you cup your two hands underneath your breast, and you lift them a couple of times. And from the right, you push, and from the left, you push, and then you beep the horn a couple of times. And if you do that approximately 10 times, you can make dramatic improvement. I was very surprised how right before my menstrual period, if I do a little breast fluffing, how much less breast discomfort I have with the hormonal changes that are normal and cyclic. She recommends doing this before you have your thermogram, before you have a mammogram. Anything that you can, anytime you have discomfort in your breast, try fluffing and see if it makes a difference. She suggests, as long as there's not a truck driver sitting just next to you, to grab your bra strap and lift it 4 or 5 times while you're at the stoplight. Move those girls around, give them a little motion, because in our modern fashion, we strap our breasts to our chest wall and don't allow them to move. It's important. I cannot overestimate how powerful diet is in our overall wellness, and for our breasts included. Recognize the error of our ways. We live in a society where we eat crap food, and we want to recognize that that's true. Most of us consume a standard American diet, which I call SAD. The standard American diet is notorious nutrient, phytochemical, and fiber poor. It's full of saturated and damaged fats. It's full of nutrient depleting and insulin stimulating simple sugars. In fact, at Michigan State University, they found that girls who eat a high-fat diet during puberty, whether or not they go on to become obese or overweight later in life, are at greater risk for developing breast cancer. So for those of us who have teenage daughters or teenage granddaughters, or who will one day have teenage granddaughters, it is important for us to empower them with information and to help make an active change. If you're shopping and out to lunch with your daughter or granddaughter, don't pull into McDonald's for French fries and a hamburger, because you may increase your risk for breast cancer later in the future. Go down the road just a little bit farther and get a salad. Go down the road just a little bit farther and have a chipotle salad with rice and beans and organic chicken.
Moe's has organic and tofu and all that stuff.
Moe's and Chipotle are among our favorite of our fast food restaurants now. Be willing to change. Eat the rainbow. High fiber, low glycemic index foods, phytochemicals, full of the colors of the rainbow. Why do these foods have all these colors? Well, they're put on there. Mother Nature put those colors for a reason. Many of them are sunscreens. They protect the plant from ultraviolet radiation coming from the sun. They protect the plant from wind damage. They protect the plant from insects. They excrete toxins that are noxious to bugs. When we eat those foods, we get the same benefits. We get the same protection from ultraviolet radiation. We get the same protection from toxins that those plants did. That's why we want to eat that rainbow of colored foods. Soy is a whole nother story. Soy foods are probably good for us in small amounts in moderation if they've been unadulterated or cultured. Miso, tempeh, edamame are probably good for us. I'm not a big fan of tofu and soy protein milkshake, soy milk for the long period. For a short time, once in a while, if you want a little soy milk in your coffee, I do not really have a problem with that. But making a ginormous diet full of nothing but soy is probably not a healthy thing to do. Fiber is important. In this study from American Journal of Clinical Nutrition, we found that for every 10 grams of fiber you get in your diet, you get a 7% reduction in breast cancer. Most of us should be consuming somewhere between 35 and 60 grams of fiber a day. It's hard to do. You really have to focus on it. Eating high carbohydrate diets with high glycemic index foods increase your risk of developing breast cancer. Next time you're offered a donut, think about the girls. A diet that's high in fruit and vegetables, however, decreases your risk of developing breast cancer. This was an interesting study. They were studying high blood pressure, and they were teaching people how to eat for their blood pressure using the DASH diet, dietary approaches to stop hypertension. And they found that while they did lower their blood pressure with diet alone, almost as much as your first-line drugs, that you actually decrease your risk for breast cancer as well. Entire books are written about diet for breast cancer. Bob Arnott wrote one that's probably worth reading, especially if it's a risk that you're concerned about. We know toxins play a huge role in our health in general, and especially cancer risk. Pesticides, herbicides, petrochemicals, plasticizers, bisphenol A, residual hormones that are found in our drinking water and everywhere else are indicated.